The stages of labor and normal vaginal birth. This informational video will discuss the following: the stages of labor in a nurse-patient setting, demonstrations of stretches and activities for the mother to do during each of the 3 stages of labor, the common misconceptions that people have about labor and birth, some other helpful tips that bring relief to women during labor, the role that the nurse plays during each of the 3 stages of labor. The aim of this video is to inform mothers about the process of labor so that they feel more prepared and comfortable when the time comes for them to give birth to their baby.
Maddie, I'm Katie. I'll be your nurse today.
Hi Katie, nice to meet you.
Nice to meet you too. Alright, so as we're nearing your due date, do you have any questions about labor or anything like that?
I think the only thing is, could you elaborate on what the stages of labor are?
Yeah, so the first stage is when your cervix is going to dilate from 0 to 10 centimeters, and 10 centimeters is fully dilated. So in the first stage, the cervix opens and softens a little bit. There's a discharge of show, which is bloody stained mucus. You might have lower back pain or cramping pain that comes and goes. There might be clear pink fluid coming from the vagina, either rapidly or slow leaking, so that'd be like when your waters break. If discharge is green or blood red, you should contact your doctor as soon as possible. And then you also might have loose bowel movements or the urge to vomit.
Okay. And how long does this first stage typically last?
If it's your first pregnancy, it can typically last 12 to 16 hours. If it's a multiple pregnancy, then usually 4 to 10.
Gotcha. So how do I know when I should go into the hospital?
Well, you want to time your contractions from the start of one contraction to the start of the next contraction.
Okay.
And then typically we advise women to go to hospital when their contractions are regular and about 5 minutes apart. And the telltale sign of a strong contraction is when you can't talk through it, so you have to take a break or a deep breath.
Gotcha. And then is there anything that I can do to help with the pain before I go into hospital?
During the early stages of labor, some of the things that you can do to help assist in the process would be to have snacks regularly so that you can have energy throughout the whole laboring process. Try to rest as much as possible. Some women may experience the urge called nesting leading up to labor. So when you have those certain moments where you feel like cleaning or just tidying up, try to conserve those energies for your laboring process. We do encourage women to go to the toilet regularly to empty your bowels, or just try to take a bath or shower so that you can relax. The most important thing during the early stages of labor is to stay at home as long as possible and keep in communication with your GP or your midwife. So while you're talking to your GP or midwife, they can ask things like how far along your contractions are so that they can see the progress of your labor. Or if there are signs of strong labor, such as your water breaking, regular contractions, or blood loss, do contact the hospital right away. If the signs are too vague and you're not sure if you've really moved into strong labor, the best thing to do is to try and stay at home for as long as possible. Research has shown that women who stay home longer during the first stages of labor do end up going through labor a lot easier than others.
After the cervix is fully dilated, the second stage of labor begins, and that means it'll be time to start pushing. So there's going to be an increase in bloody show. There'll be longer and stronger contractions, increased pressure, especially in the bowels. You might feel your baby's head moving down towards the pelvis, and then by the end of the stage, the baby will be born.
Oh, wow. So how long does this stage typically last?
Similar to the first stage, it depends per each pregnancy, but if it's your first pregnancy, it's usually 30 to 90 minutes, and then if it's multiple pregnancies, 5 to 60 minutes.
Gotcha.
So some of the things that you can do during the second stage of labor would be 1, Don't worry whether or not your bowels empty during the labor process. This is a very natural thing and does occur to many women. Make sure you try to rest in between contractions. Conserving your energy during the laboring process is very important. And then try to allow your body to relax and just go into its natural instincts. Your body was created for this process, so trust your instincts. They're going to help you get through the laboring process. So some things that you can also research are different positions or birthing methods that can help with delivery. So things like standing upright, lying on your side, kneeling and leaning against a ball while you're in labor can help the baby move along and push the baby into the right positioning for labor. Different birthing methods other than the standard C-section or normal vaginal birth do include assisted vaginal delivery. With assisted vaginal delivery, the doctor just helps the laboring process a lot more by being more involved in it. One example of assisted vaginal delivery would be an episiotomy. So this is where a surgical incision is made from the vaginal hole to the anal hole that allows more room for the baby's head to come out of the birthing canal. Another example of assisted vaginal delivery would be the use of the vacuum, where a vacuum is cupped to the baby's head and also the baby's head is guided through the vaginal canal. So other things you can use to help assist you during the second stage would be thinking about the place that you maybe want to have your baby. Some women do prefer at-home births. This gives you more control over your labor positions, conditions of your environment, and the amount of people that you can have present during your laboring process. This does come with its own risks, so make sure you talk to your doctor or your midwife before deciding on where to give birth to your baby. Another birthing method would be water births. Water births are really helpful because they can help reduce the use of epidurals, because the warm water used in the water birth soothes the cervix so that less pain is felt as it expands.
So after the birth of my baby, is there anything else that I need to think of, or are there any more stages of labor?
There actually is the third stage of labor, which is where the placenta is delivered. So that can take 15 to 60 minutes. The umbilical cord is going to be clamped and cut, and then contractions will begin again. And you'll be given oxytocin for active management of the third stage, which aids in the expulsion of the placenta and prevents excessive bleeding after birth.
Okay. And that sounds a little scary. Is there anything that will hurt during that stage?
So the third stage of labor, you're still experiencing some contraction, so you might still feel some pain and discomfort. But some women have said that it's not the same amount of pain that you would feel during the earlier stages of labor. So do just try to focus on pushing with the contractions to help expel the remaining membrane and placenta. Some things that you could also do to help you during this third stage of labor would be changing your positions, either to a squatting or sitting position, so that you can use gravity to help expel the remaining membranes and placenta.
So some tips to help you feel better throughout the labor process are going to be sleeping as much as possible whenever you're not feeling pain from the contractions. We want you to continue your normal eating and drinking habits. Drink lots of water. Fluids are very important. Applying heat at any time when you're feeling pain. You want to keep moving. Walking around is very important just to keep your baby rotating and getting yourself comfortable. Trying aromatherapy or music therapy can help you relax. And you can always ask a friend or your partner for a massage, which will help you de-stress a little bit. Taking deep breaths and trying to meditate will be super important. And next, I'll be talking about the different birthing positions. These different positions are recommended to help decrease discomfort during your contractions. Not all of the positions will work for everyone, but you can try different ones to see which works best for you and the baby. These positions will also help in the positioning of the baby and help rotate or descend the baby into the optimal position, which is best for birthing. So the first position is sitting. This can help relieve pressure on the pelvis. You can sit on the edge of your bed or on a yoga ball. It allows for rest and relaxes the perineum, which can reduce tearing. You can also stand upright, allowing gravity to work at your advantage. It helps relieve backaches and makes contractions more bearable. You can also go down on your hands and knees. It helps open up the pelvis, takes pressure off the spine, and can possibly help boost the baby's oxygen levels. However, your arms may get tired, so you may need to take a break. You can also lie on your side. This is very helpful for when you are trying to rest. It can actually help the baby descend and rotate. It helps the baby get more oxygen, and it's good for women with high blood pressure. You can also go into a lunging stance, raising a foot onto a chair and leaning forward towards the raised foot during a contraction. It helps the baby rotate or descend. It opens the pelvis and gives baby more room. You'll want a partner to help with balance. You can also try squatting. You can hold onto a wall, a chair, or receive support from a partner. Also opens the pelvis and allows for the baby to move. If you purchase a birthing ball, you can sit on it, lean on it, or drape your upper body on it while in the kneeling position. This will help relieve pressure on your back and can help dilate the cervix further, which allows baby to move deeper into the pelvis. You can also try to walk up the stairs. This allows the baby to drop further, but could be tiring because if you are in labor for a while prior to trying this exercise, it will take a lot of effort to go up the stairs.
Common misconceptions. Misconception number 1. An epidural means that there is no pain during labor. In reality, an epidural does not equal a pain-free delivery. It is meant to ease or manage the pain. For some women, the epidural doesn't help at all with their pain. The amount of pain felt with the epidural will vary. Misconception number 2. Your water will break in a dramatic way. In reality, this can happen in the first or second stage of labor and can be a rapid or slow flow of fluid from the vagina. Most women actually have their water broken by their doctor. If your water does break on its own, call your healthcare provider and get to the hospital to reduce the risk of infection. Misconception number 3. You'll be in labor for a very long time. The period of time that a woman spends in labor will vary from person to person. A woman who has given birth before will more than likely experience a faster labor than a woman who has never been in labor before.
Maddie, I'm Mia.
Hi,
I'm
nice
going
to
be
meet
your
you.
nurse today. I'm just going to explain the process of labor and how the nurse's role is going to be throughout your labor process. So I'm going to complete an assessment on admission, which will consist of me asking about your contractions, how the length apart from your contractions, if your water broke, and what the fluid consisted of, if it was bloody, what the color was. I'll also assess for any potential risks that could affect your pregnancy and implement interventions as needed. Okay, I will also give you advice on certain positioning during labor because there's going to be different positions that make different people comfortable. Obviously, labor is going to be a time when your body is going through a big change and you're not going to feel very comfortable. I will also complete a physical exam that includes like the fetal status and a pain assessment, asking you if you have any pain, where the pain is located.
Okay, and that's when I'm already at the hospital?
Yes, this is on admission.
Gotcha.
Yeah. And I will provide certain relaxation techniques for you to help calm you down. Certain things are going to be like aromatherapy and music therapy.
Okay. So what are my options for pain relief during labor?
So the options that we offer are going to be pharmacological pain relief, which is going to be like pain meds, epidural, and we can also offer you, like I talked about, relaxation techniques that aren't going to be like pain meds. So like I said, aromatherapy, music therapy, just to decrease that pain. Okay, so going into stage 2 of labor, the nursing role is going to be ensuring that you're not pushing until your cervix is fully dilated, which
Okay.
we will be able to tell you when that is. And we will be providing you support throughout the whole process and reassurance that you'll be able to do it, because it's a time of self-doubt when your body is pushing to those certain limits. So we're going to be there the whole way, encouraging.
Yeah, that's honestly the part that I'm most scared about.
Yeah, which is totally normal. Having fear during that process is a very normal thing for ladies during birth. And we will have more than one trained nurse assisting me while we are delivering the baby to help with the delivery and make sure it's a smooth process. I will also monitor the condition of both you and your child during the second stage of labor. For example, I'll listen to the fetal heart rate every 5 to 10 minutes. I will also hand the baby right away to you after this assessment of the baby to make sure everything's okay for skin-to-skin contact, because that's really important after the baby's born.
I've heard about that too.
Yeah. Okay, so something that's not common to think about for the third stage of labor is the actual delivery of the placenta after you deliver your baby. So I'm going to assist you with pushing one more time to deliver the placenta. And I will be administering oxytocin to help reduce any blood loss after you deliver the placenta.
Okay.
And I'm just going to continue to monitor you, make sure your heart rate is okay and everything like that. And I will also perform a uterine massage.
This video discussed the process of labor and normal vaginal birth. By listening to dialogue between an expectant mother and nurses, being informed by things that bring women in labor relief, including stretches, rest, activities, and positioning, hearing about the common misconceptions of labor, and learning about the nursing roles during each stage of labor, the hope is that you have a deeper understanding of the 3 stages of labor. Being informed about this life-changing process is the best way to reduce stress that's relating to giving birth. It is always important to remember to reach out to your GP with any questions or concerns that you may have. Never feel like a question is too small or too unimportant to ask. The health of your baby depends a lot on what you do, so try your best to educate yourself as much as possible. Thank you.
No, we can cut it there and then
Your body was built to do this one thing you're doing right, dang it. The body was created.
It's okay, you can keep going. She'll cut it.
Okay.